Next episode, last visit, first podcast from Scottsdale, Arizona. My good friend and leader in this community, Scott Levy, the Chief
Government Affairs
Officer, CGO, the CGO for the Alliance. Welcome.
Thanks, Tom. Appreciate you having us. It's great being out here in Scottsdale. It's a great place.
So what are you doing here?
Well, Lincoln's been great. They've been a great partner for the Alliance. I was on a panel this morning talking about, how we use advocacy and policy in our messaging and, talking with the executives that are here, letting them know how important advocacy is and having this platform, the top leaders in the industry captured in one place. So we're trying to preach the good news about what's happening and get more people involved.
Yeah, I love how the two organizations work together on this. It's super important for the industry. If we don't gel together, we're just going to get beat. And so I love how that they invite you to your conference. I know they come to yours and vice versa, and you guys all work together. And years ago, we didn't work very well together. So it's good that we're doing it now.
I mean, that's part of, why the Alliance exists now. We had two really long-standing, successful organizations with NACH and NHPCO, and then also the partnership. But, with everything that's going on from a policy perspective, we've got a lot of M&A activity and how that's impacting our space. Coming together, being one voice, and then having partners like Lincoln allow us to come here and present and talk to the leaders about why it's so important that we're collectively together. It's a huge opportunity, and it's something that, on behalf of Dr. Landers, our CEO, and Cheryl Brand, our COO, we took the time to be out here to make sure that we were not only working on policy and what the messaging is, but also like finding out from our members and our non-members, what is it, that's keeping you up at night? What is it that's holding you back from a policy perspective? I mean, we know what a lot of those issues are, but how can we better articulate, or how can you get more involved with us so that we can spread the message even more?
You learn anything new this morning as we were going through the presentations and those things?
Yeah, I mean, the presentation where it showed the different, personal accounts from the family members and those that were receiving the care, I think it was really interesting to get the perspectives about continuity of care. And
I thought that was weird too.
The continuity of care from a provider's lens, like, all right, we got to make sure that we have someone out there within the times that we told them to be. But continuity from the patient's perspective, the family's perspective, is they want to have that familiar face. So different levels of continuity. And I know, like, I talk about how, I spent 10 years at a medicist, but I really didn't know what I was getting into until I got there. I'm a lawyer, lobbyist, political guy, at heart. But then I look backwards. I had at that time, two of my three grandparents had been through home-based care. One of them, had the benefit of being at home for hospice, but we had personal care attendants there. And after my grandfather passed away, they stayed and they cared for my grandmother. So understanding how that continuity from those care attendants carried on, and they were like part of our family for years. So seeing that now, and it helps me translate into a policy level when I'm talking about, hey, look, we're crunched from a staffing perspective, Congressman X, Congressman Y, and how does that impact your constituents? Your constituents want to see the same caregivers. And, from a scheduling standpoint, we don't necessarily have the ability to do that right now. So it really helps me tell our story.
It's like you go to the hospital and you have a doctor who's supposed to take care of you, and then you have a different doctor every time he comes in. That'd be like really awkward.
Yeah.
Like you got to ask him all that stuff again. And I see that. My grandma was on hospice, and she had a dog named Cinnamon. And Cinnamon was a mean dog. He was a little poodle, and she was mean. And so once Nana got you comfortable with it, Cinnamon, you could come in. But if somebody else knew is coming in all the time, now it's causing more drama in the home. And that hit me too. And I saw those messages come across. And I think COVID really changed that. We used to always have the same nurse, and you took care of a caseload. After COVID, it became just find me a nurse.
Yeah.
We have so much business. I'm just happy to have a nurse out there. But you forget about, you have a stranger knocking on your door. If someone's on hospice, they're a little bit uncomfortable with that anyway. And now you have a stranger coming into your home. Now you got to get to know them. You got to figure out who they are, what they do. They got to get to know you.
Yeah.
Where are the medications? Where are the supplies? You're asking a lot more questions that you wouldn't have to ask if you'd been there before.
Yeah.
So that one struck me too. The other one that got me was, there was a lot of like semi-complaints, not complaints, but there were discussions that if we just checked on the nurse that went into the home, or if we just sent them a survey and we said, hey, what's wrong? They wanted to spend more time, or they wanted you to do something different, or they wanted to make sure you had a good positive attitude, or whatever it was, then we could hopefully solve those problems before we got to the end of the episode, or discharge the patient, or the patient passed on, and now the family's frustrated. If we just knew that as leaders, we would be able to do something.
You'd be able to fix it, yeah.
And so those two really got me as well. Big topics going forward. Where do you think we're headed on advocacy stuff?
Yeah. Well, we've got a couple things coming up. I'll plug quickly. So, I mean, this is a great conference, but we've got one coming up in October where it'll actually be in Washington. So the annual conference for the Alliance will be in Washington, October 27th through the 30th. Registration for that's live. But before that, we're actually going to go to Boston and do what used to be the Financial Managers Conference, but now, as the industry is evolving, it's actually going to be the Financial and Tech Conference in Boston in mid-July. So another great opportunity where we want to see, our friends out there, good programming. And then I'm going to plug one more event. The dates aren't set yet, but we will do another annual fly-in in Washington sometime in September. Stay tuned for that. This past year, we had the most advocates fly in quite a while, with about 250 members from around the country coming in to, go on the Hill and spread the message about home health, hospice, and Medicaid services. But from a policy perspective, I mean, rate reimbursement issues are constantly going to be there. We have a good story. We have got expertise on the team. We've really built up a new team at the Alliance, taking some of the existing talent from legacy NHPCO and legacy NACH, but also bringing in some new blood to really look at how we're doing our advocacy. So reimbursement is always a part of that, but fraud and abuse is, a big part of what's going on right now. So every conversation that we're going to have on policy, likely for the rest of this year, there's going to be some aspect of how we as an industry are coming together to really, lock arms on eliminating fraud, waste, and abuse. And specifically the Medicare home health and hospice benefit is the most that we've been hearing about from the administration, but we know that there's, issues in Medicaid, and our line all along has been, we need to make sure that the benefits are sustainable and that they are there for those that are eligible to receive them,
Yes,
and that the
sir.
providers who are providing care are true providers. They've actually been vetted. And so we want to work with CMS on how you stop those providers from ever getting in, instead of having to chase them once they're in. And, the pay and chase costs so much money.
For
We
sure.
want to work on what they can do to help prevent those bad actors from getting in the first place. I do think a lot of collaboration on fraud, waste, and abuse will be another part. As we also, hospice continues to be, changing. We know HOPE implementation is underway right now. So just making sure we're staying close to our providers, understanding what it is. If they're having issues, let us know so we can be their advocates with
Sure.
CMS. So
I was looking at the Alliance newsletter. I get it every morning. It's the kind of bulletin board,
Yeah.
and there was all kinds of traffic today around the HOPE and the follow-up assessment visits during a snowstorm.
Yeah.
And when they wrote that policy, I promise you, they didn't think about what are we going to do in the event of a crisis in North Carolina, or
exactly.
South Carolina,
Yeah.
or
A snowstorm
Florida.
that's, 40-year event.
Yeah,
Yeah.
takes out, but there was all these people in there, and they're all trying to figure out, what do we do for the HOPE visits, and if we can't get to them, we're supposed to follow up, and it was pretty interesting. But that's a forum that I don't think many people use. I read it every morning, believe it or not. But there's a lot of action that goes on there, and I know Mary and all kinds of your staff are always answering the questions and putting the policies out there. It's something that I really appreciate. But if you're not a member of the Alliance, then you're not gonna see that forum.
Yeah.
And it's actually really good. I was blown away by it this morning.
No, I appreciate it. Yeah, the team's really, very diligent in making sure that our members are aware of what's going on. And so whether it's through an Alliance daily article, we've got specific newsletters to each one of the service lines, but also you can pick up the phone, call, email anyone on the team, and we're pretty diligent about getting back to folks. But we want to grow the membership base, and so appreciate the opportunity to talk about what it is that we're able to provide the members. It's not just, policy work. I mean, it's helping you with advocacy, but we've also got subject matter experts. If you're dealing with a specific issue that's coming up or it's happening right now, and you can call us, and if we can't get the answer for you, we can help point you in the right direction.
It's awesome.
So.
What's you guys were just doing some stuff with Dr. Oz over at CMS. What were y'all doing with him?
Yeah, his office reached out to us to see if we could help them get some providers out to Los Angeles to talk about fraud, waste, and abuse. He wanted to hear from the providers on the ground.
They reached out to you?
The woman, Kim Brandt, is the deputy administrator over program integrity. We've been collaborating with her a lot. She reached out to Hillary Luffler, who's our VP of policy
Awesome.
and regulatory affairs. Yeah. And said, look, we're doing this event. We know that the Alliance is really supportive of, eliminating fraud, waste, and abuse in the Medicare program. We're going to California. We're going to Los Angeles. The administrator wants to hear, not from people like me, but from people who were on the ground in Los Angeles. So
That's awesome.
we went and we had some of our provider members out, and I'm not talking about executives. Like, we had, people who were on the ground providing care in the homes, making the hospital referrals for them to be able to tell Dr. Oz directly what it is they're hearing. And he's very focused on it.
Good. I'm glad he's listening.
Yep.
That's
So,
awesome. And I love it that they reached out to you.
yeah.
My whole career, we've been reaching out to them, and I get a response every now and then, but nothing like that. So that's awesome.
So it's great.
It means what we're doing matters, right?
Yeah, it's a community effort, collective. There are a lot of people who are putting a lot of time, energy, and effort. Some of the providers have been very out front on, calling, and I'm going to say the administration, I'm not talking specifically this administration, the past administration too, that they need to take fraud, waste, and abuse seriously in the home health and hospice space. And, we're starting to see some traction on that now.
Yeah. In some of our other businesses, there's a political action committee that's been put together to help raise funds to help do this kind of thing. The Alliance has one of those, right?
The Alliance does have a political action committee. It was formed through the merger of the organization, so it's a carryover of the old NACH PAC, but we do have a political action committee. We are able to raise funds from our members through a very rigid solicitation process that we're required to follow by the FEC. But if people are interested in the PAC, you can go to our website. There's some information about how we could talk with you more about it. But, writ large, the PAC is something as we're in healthcare services, we're a membership organization, and we want to make sure that our story is getting told. Having a PAC that is funded is, part of, one of the tools in the toolbox, and it's one that we need to actually do a better job of raising money for. And so if you're interested, feel free to reach out to our website or send me an email. I can make sure you get the information you need for it when we go forward.
And I'll have Cole post that in the show notes for the show. So if you just look down in the show notes, you'll see that the puzzle pieces. All right. The election's coming up this year. Midterms, any guesses, thoughts on how that's going to impact home health or hospice? And
so I talked a little earlier, I threw 4 different dates out. It was the 2008 election, the 2016 election. It happens to be some of the most recent ones, but 2020 and 2024, those are where we saw uniform control of Congress, where you had whoever won the election also controlled the House and the Senate. That's the typical when you see the most opportunity for there to be massive change in policy. ACA, the tax cuts from Trump, Biden's Inflation Reduction Act, and then this year the changes in the tax cuts in the Medicaid program. I'm anticipating we're going to have divided government in the next round. If that means both the House and the Senate flip, I don't know. But I think as of right now, things look like the House is definitely going to flip. But that's 10 months away. Elections, a lot can change. I will say, historically speaking, the first midterm election of a presidential cycle, usually the party flips. You look back in 2010, President Obama lost a lot of seats. 2018, President Trump lost a lot of seats. I'm anticipating we'll see Democrat control in the House. And what does that bring us? Divided government usually is where compromise has to happen in order for them to get anything done. So there's some possibilities, maybe some incremental things happening, but we're preparing for that day in, day out, making sure that we stay. And this goes whether it's, political action or policy work. Our team talks Republicans, Democrats, House, Senate all the time, because you never know when these things happen. And we have to make sure that we're playing the long game. We're trying to develop new relationships. The turnover in Congress right now has never been higher. You got, people retiring left and right. So those freshmen that are coming in there, we got to make sure we're getting in front of them so they understand what home health and hospice are, what the Alliance is, what Medicaid home and community-based services is, how that's different from home health. It's a big part of it is educating people.
For sure.
What is home health versus what is home care services, what is hospice. So I think that was the other thing that came up this morning. Our perception, it was home health, OT, PT, outpatient therapy, personal care services, hospice. We see all these different things. And on the other side, the patient sees home care. They see it all as one. And so educating, and that's how lawmakers often see it too. Like we have to really educate them on what it is, the services that we're providing.
Especially like on, the homebound status is a big example of that. In hospice, you don't need a homebound status. In home health, you do. In home care, you don't.
Yeah.
So understanding the policies and how they're written for that, for sure. Good. Okay. People want to get a hold of you. How do they do it?
Alliance website, easy to find us, but you can reach out to me. My email is all over the website. So Scott Levy. So it's slevy@allianceforcare.org. You can get to our advocacy page. You can see the whole team on there. We've also got a very robust social media page. Our comms director, Alyssa, does a fantastic job, and her team pushing things out constantly. So you can really get in touch with us, pretty easily.
And what's Dr. Lander's podcast called?
The Who Cares podcast.
Who Cares?
So he does one called Who Cares. It's where they hit pretty deep on some different policy issues dealing with in-home care.
Yeah, I've been on that one a couple times with me. It's good. It's fun.
Yeah,
she does a great job.
Yeah, she does a good job. So
okay. Well, thank you.
Thank you.
Appreciate you being here.
Appreciate it.